This episode contains graphic descriptions of real medical scenarios faced by real medical professionals. Listener discretion is advised. From Knowledgeable Provider, this is Critical Incident. Hello, welcome back to Critical Incident from Knowledgeable Provider. I'm your host, Jody Marks. Got a very entertaining interview to share with you today. My guest is Lieutenant Colonel Rick Caniglia, U.S. Army retired. He and I have been working on some emergency preparedness stuff at our church, and just in conversation, it became apparent that he had some pretty cool stories about the military medical system. Rick is not himself a medical person per se, but over a 25-year career in the Army, he had a lot of unique interactions with the medical system and situations that are somehow medical in nature. And he agreed to sit down and talk with me and share his stories with all of us, for which I am greatly appreciative, and I know you will be too. Rick commissioned into the Army in 1976, spent the remainder of the 70s in Germany, went to flight school in 1981, where he learned to fly both rotary and fixed-wing aircraft, spent the next 4 years doing aviation research and development at Edwards Air Force Base, then went to Korea, where he flew intelligence gathering missions over the DMZ, then on to a staff assignment at Fort Monroe, Virginia, back to Germany in 1988, flying the same sorts of intelligence missions he did in Korea, deployed as part of Operation Desert Storm from 1990 to 92. After that, more aviation R&D, followed by running an Army aviation maintenance school. By the mid-90s, he was in the Pentagon, writing policy and supporting Army and Joint Operations Center during Haiti and Bosnian operations. He did an interim tour as a Department of the Army Inspector General, and ended his military career with an international billet, forging interoperability agreements among the major English-speaking armies of the world. How about that? What a career. This is one of those interviews where I don't know anything about what we're talking about. Typically, I will come up with a list of questions, which I share with the guest in advance, so everybody has a chance to kind of know what we're going to be talking about. In this situation, though, I pretty much just shut up and push record and listen to what the guest has to say. This is definitely the most you'll hear me speak during the rest of this episode, and I really have nothing else to say. So here you go. Please enjoy my conversation with Rick Caniglia. Rick Caniglia, welcome to Knowledgeable Provider. I appreciate your time. I've been looking forward to the conversation.
Very happy to be here.
Awesome. Thank you for sharing all this with us. I'm excited for story time.
All right, story time.
And first of all, thank you for your service. In all seriousness, much appreciated. I know we rattled that off, but
well, you're
all
welcome.
Due respect to you.
But also, I will say then, thank you for your service as a nurse, because without you, we would be in a world of hurt. I've watched my dad and others require nursing care. Great respect.
Awesome. Thank you very much. Appreciate the kind words. I thought maybe to start off, and if this is too big of a question to just throw at you, that's okay. But I was thinking maybe you could just give us a bird's eye view of the military medical system. I've never had anything to do with the military. I mean, I have some idea of what the VA is, and you hear about Walter Reed and Bethesda Naval Hospital and the news and stuff. But other than that, I don't really know how the medical system in the military works. So who takes care of our military personnel?
Well, it depends on whether you are in a combat zone or potential combat zone, or whether you're back here in the States, if you will, or some very secure place. So you start with a certain percentage of regular troops that are given what we call combat lifesaver training, which is a step above first aid. We used to get first aid in our training. Everybody got that, how to apply trauma dressings and such. But combat lifesaver is a step above that. And you'd have to look up what they in particular can do. Medics are a step above combat lifesavers. And then you go back to where you have actual physicians or physician assistants. And they can be located fairly close to the front also. So the old MASH series was not that far off. You get immediate treatment up front, you get evacuated to an intermediate facility like a MASH. They don't call them that these days. That's where you would get emergency room treatment, and then evacuated to any number of hospitals that have they're increasingly capable. And that includes being transported all the way back to the States, where you'll go into essentially a general hospital. Walter Reed, Bethesda, you can think San Antonio's got hospitals. And they're full-service hospitals for treating, and for rehabilitating. So that's essentially it. It's really not that confusing. Most brigades, sometimes regiments, so we'll say occasionally if you are an infantry battalion with roughly 1,000 people, you might have a doctor assigned, and they will very seldom ever see that doctor because those doctors in the combat zone tend to get consolidated at the facilities, the ER, if you will, or the MASH. So when I went to war in Desert Storm, this is jumping way ahead in chronology, we had a doctor. All the time we were in Germany, we had an assigned doctor who would occasionally come by and do sick call. But generally, sick call was done at the dispensary or the hospital in the city. We went to war. He came with us. We never saw him because he was diverted to the Corps Support Command medical facility in the rear to do whatever. But one caveat for that description I just gave you is my experience ended in about 2001. So in the last 24 years, 25 years almost, they could well have reorganized in some form or fashion. But it's not going to be that different from what I've described. Increasing levels of care.
Got you. Well, yeah, I'm ready to hear it. I'd love to hear about your most memorable interactions with the military medical system.
Well, I thought I'd take it chronologically, and that means starting with when I came into the Army, right? So there was an induction physical. Well, we've all heard of those to get into the Army. All right, so the induction physical is just a thorough physical that you would imagine. All right, I had one going prior to getting into ROTC, and then the pre-commissioning physical, which is my induction physical, was just a thorough, common physical. They did an EKG, looked in your eyes and ears and nose, poked you and prodded you in all the ways that they would, took blood, and then patted you on the back and sent you off to wherever you were going. They found a couple of things that later on would become significant, and we'll talk about those. One was bi- and trigeminy.
Okay.
Also, I had a deviated septum from multiple childhood accidents. I've actually broken my nose 5 times.
Wow.
Yeah, I lead with my nose. You know, it's in being Italian, it's a hazard.
Sure.
And then there was a varicocele, which really never played in any screening that I had later, but they did warn me that it was going to give me some trouble having kids. I didn't have a wife at the time, so who cared? But that gives you an idea of the level of screening, basic screening that would also catch these kinds of things.
Do you have any sense of how common it is for people to find out for the first time that they have some major medical issue in that physical when they go in the military?
Well, I think it's probably fairly common.
Yeah.
I mean, that was my experience. I had no idea that my heartbeat was irregular in some fashion.
Sure.
Even though at that time and every subsequent physical I had, and I had lots of physicals because I flew, they always declared it within normal limits after a cardiologist had reviewed it. So whatever they're teaching in med school, it was consistent.
Sure. I have a patient that I just saw him earlier today, actually. He's going through the process of going to the Naval Academy.
Mm-hmm.
I try to be thorough with everybody, but every time I see him, I'm always like, I really don't want to miss anything that's going to show up whenever they do whatever they're going to do to him.
I'll talk about that when I get to flight physicals, and going into flight school. But after this initial induction physical, you go to training, and then you are going to get commissioned. When I had my initial training, just prior to commissioning, we went to summer camp, which is officer basic training. And when they sent us through their screening there, they did things like fitted us with earplugs, and we got inoculations. And that's where they line you all up. Your sleeves are rolled up on both shoulders, and they would come at you with what I called a multiple needle inoculation gun. They were still using these. I understand they're not today, but they did at one time. Now, this may have been a pneumatic injection using air, but I seem to remember that it was needles. How they sterilized the needles in between, I have no clue. So they probably didn't.
Lovely.
The one thing they would tell you as you walked up is relax your arm. And they had told us to be relaxed or we could get cuts or tears. And they would warn you when it came time to get it. Some guys didn't relax and did get a cut or a tear in their skin. Well, the reaction of the medics was always one of irritation. I don't know why they were irritated, because the only thing they did was slap a Band-Aid on it and send the guy down the row. No blood, no Band-Aid. Right? Today you get a shot, somebody's going to put a Band-Aid on it. Not when I went to Fort Lewis, Washington. So during that training, we're out in the field a lot. I remember many incidents, but there's some that stick out in my mind. We had a guy that was walking on patrol in the woods, and all of a sudden, there was the most horrific screaming. A horror flick doesn't come close to this. I can still hear it today. He had been swarmed by ground bees.
Oh, no.
Yeah. I don't know how they got the ground bees off. We were told to get off the trail because the medics came running. They brought stretchers with them, and they decided that they weren't going to take him back by ambulance. So they hauled him over to a field and medevaced him back to the post hospital. We never saw him again, so I don't know what happened.
Wow.
But you wanted a medical story? There's a medical story. Personally, I was driving an armored personnel carrier around a track. The driver can be either down on a seat or standing up and driving, because you can reach the controls. Now your head's outside a hatch and you're looking out at where you're going. And that's the way we were doing it, right? So my hands are down there controlling the APC, and we're rolling along at some moderate speed, 15 miles an hour. It wasn't very fast, when I hit a ditch. Now, I had been leaning forward so that my chest rested against the front of this hatch, which means my chin was over the edge of the hatch, which has a nice tang, a nice ridge that sticks up. And when we hit this ditch, of course, my chin hit the tang, and I felt nothing, right? We passed through it. I stopped the APC. The sergeant, who was sitting in the commander's hatch just off to the side, looks over at me, and his eyes go big. Eyebrows go up. He says, "You feel okay?" And I said, "Yes, Sergeant, I feel fine." He says, "Well, look at your shirt." And my shirt was drenched in blood. So I had a laceration that was probably about 2 inches wide. They called the medics up, and I got out of the APC, and everybody is wondering if I'm going to fall down, but I felt fine. The medic comes up, he looks at it, and he takes a combat bandage, and he pushes it against the bottom of my chin, and he says, "Here, hold this." Okay, so I held it. And he says, "Follow me." And I walked back, and we got into an ambulance, and they took me off to the post hospital. Same place he had taken the kid with the bee stings, but I had no stings. So,
oh, this was the same day?
Same day.
Oh, okay.
So we get there, go into the ER. They have me take off my shirt, lay down on a table. They come in, lights are positioned. Nurse looks at it. They do a cleaning, right? They're cleaning me up. And I still don't feel any pain. And a doctor comes over and looks at it and says, "Well, I think you're going to need some stitches here." And so then they bring a tray in, put it over my chest, well, kind of nearby. And they drape me. Now, my eyes weren't covered, but I couldn't see the doctor who's going to work on my chin. I could see this nurse standing off to the side. And the doctor comes down, and I feel them give me a shot or two. And again, no sensation, no burning, because it's still numb. That doctor then, he says, "Okay, I'm going to start stitching." And I feel a pressure, and I feel a tug, and I hear the nurse go, "Uh-uh." And I look over, and she's very gently shaking her head side to side.
That's what you want to see.
That's what you want to hear. And the doctor, he looks up now, you can see the top of his head and his eyes, and he goes, "Too close to the edges?" And she goes, "Uh-huh." And I feel some more tugging, and then I feel some more pressure, and I can see the doctor look up, and I can see her nodding gently off to the side. And so then he continues, and to this day, the scar is a very pretty scar that I cover with a beard. But I didn't for a long time. It's just a nice, simple line. He did a good job after he had learned what good looked like.
Sure. Yeah, I think you have both of them to thank for that.
Yeah, I do.
They got seatbelts in those APCs?
No.
No.
Well, at least not that I remember.
Okay.
If there's some infantryman out there, it's going to say yes, but I don't know that.
You were not restrained when this happened.
I was not restrained when this happened because I was semi-standing up, looking out, my head's over the top of the APC.
I didn't know if you might have been harnessed in somehow or anything like that. No.
So this is where some infantryman that drives APCs is going to say, yeah, you sure were stupid. That sergeant should have told you. That's not how you lean. You don't lean forward. Nobody did.
Sure.
And there's a story for you. But the treatment was good. And when it was all done, with a bandage over the stitches, I was sent back to the unit and continued training that afternoon as if nothing had happened. So, there's not a lot of wimp factor that's tolerated, at least in my Army.
Sure.
I presume it's still the same today. An example of that would be toward the end of training, I severely sprained my right ankle. We're on a bus being taken out at night to a place we're going to do night patrolling. And we're coming down the steps of the bus, and I decided to jump past the last step and just hit the ground, which happened, unfortunately, to be where there was a hole, about, maybe 6-8 inches deep, and my ankle went over immediately.
Ouch.
And the pain was immediate. And I don't remember how I got to the ground, but that's where I was. So now I'm groaning because it hurts, right? And I'm taken into the ops tent, the operations tent, and it's pretty clear that I'm not going to be walking patrol tonight. So I'm sitting there. They put me on the radio so I could still participate. That's where I watched the ops sergeant make coffee by putting grounds in a green sock and dumping them in a pot that had boiling water in it. They boiled the water. Worked fine. I'm sure the sock was clean.
I'm sure, right.
But that was a field expedient, and that's an aside, unless you think there's some medical implication there. There was no medevac. I just limped around the tent, kept the boot laced up. The next day, I went on sick call, and I show up the doctor, and he takes the boot off and pokes and prods and twists, and there was a little pain involved in that. But he said, well, I don't think it's broken. Never took an x-ray. I don't think MRIs were a thing then. But he clinically decided that it was a serious sprain. I may have torn something, but I didn't break anything. And he said, I'm going to give you a cast, and we're going to send you home. And I said, I've got 5 days of training left. I don't want to come back here for another 6 weeks.
Oh, yeah.
And be recycled next year. I'd like to get commissioned. And he says, no, he says, I don't think you can get around. I said, Doc, give me a chance. And with my pleading, I didn't have to bribe him, but I had to plead. He said, okay. He said, tell you what, I'm going to send you home, back to the barracks. You're going to go to training. You're not going to sit in the barracks. And if you come back here, you're gone, period. I said, okay. So I went back to training, and over the next several days, I wore a significant blister in my right palm. Because if you know anything about an M16 of those days, they had a sight that stuck up a number of inches over the barrel. And you could put your hand on that and use the M16 kind of as a cane.
Oh, okay.
Right? Because that sight, when the M16's butt is on the ground, that sight's horizontal to the ground. So you can use it as a cane to get around. And that's what I was doing.
Mm-hmm.
No one was allowed to help me. The NCOs, our graders, have been told by the doctor in his written note, I had to do this on my own. Well, okay, I did. And I had a bloody hand, but okay, you put Band-Aid on it and you tough through it. And that was fine. And the next to the last day of training, we had to go to the hand grenade range. So I get off the bus and I'm limping forward using my M16 as a crutch. And I get told which pit to go to. They call them pits. There are actually 3 walls of sandbags. On the inside, there is, along each wall, a pit, if you will, that's been dug. So if you drop the hand grenade inside the enclosure, it can be kicked into this trench that goes all around and explode without harming you, right? So I go up there, and the NCO that's supposed to teach me how to throw this, watch me, he's a safety guy, his eyes are not happy. He's looking around like, someone please come get me. I don't want to be here. I get up there, he says, are you capable of pushing off on that right foot? He says, because you got to push off to throw this thing. You're right-handed. I said, yeah, I can make that work. He says, you're sure? I said, yes. He says, okay. There was this pause. So we get up there, the instructions. I get the live hand grenade in my hands. I pull the pin. I put my arm back. I push off. The grenade is supposed to go a certain distance for you to pass the course. It wasn't a far distance, but I probably made it by 6 inches. Then you drop to the ground and you wait for the explosion. It all happened. I got up. That NCO just looked at me and I wandered off. Now, as far as I'm concerned, that's a medical story.
For sure.
It hurt. You powered through it in those days and you didn't complain. I graduated. Life was good.
Excellent.
And I went on to get my commission not long thereafter. You had to pass this basic training for officers if you were going to get your commission. That was all at Fort Lewis. Got commissioned, went to Fort Knox, Kentucky for a course in maintenance. And while I was there, I didn't realize they'd do this, but I had orders to go overseas, and that's maybe why this was being done. They reviewed my medical records, which included dental records. And I got called out of class with no warning and told to report to the dental dispensary. And I did, and they said, you're going to have 2 wisdom teeth pulled. And I said, really? I always thought this was a big deal. They didn't seem to think so. So they sent me back to the dentist. They got shot up with they're probably still using Novocaine in those days. Today it's something else. But I got shot up very nicely with a lot of Novocaine, and they poked and prodded to make sure that I was numb. A doctor comes in, dentist comes in, and pulls 2 wisdom teeth. One of them wasn't easy, but they got it out. And there was no additional surgery, as I think of surgery, to be done. Whatever they did worked. They got both those wisdom teeth out.
Yeah, I definitely think of wisdom teeth. I mean, I don't know anything about that really, but I think of that as like you go to sleep and it's a surgery and they, gently cut them out. And yeah.
I've had a broken tooth, a molar pulled before. This was more work, but they got them out. Okay. So then they tell me, you're going to go back to class, report back to class. I said, fine. They gave me no aspirin, no nothing. They just go back to class. So I walked out of the building, and when I get onto the front sidewalk, I felt a little dizzy. So I sat down on the curb and waited for probably 20 minutes for the dizziness to go away. Dizziness got better. I got up and walked a mile back to class and had the entire afternoon of worth of classes with no painkillers.
Wow.
It hurt, but in those days, I guess you had to ask for the painkiller. There was nothing beyond that. All right, so I finished that training and was deployed to Germany. And when I got to Germany, we got, as part of our routine training at a ground unit, a refresher of all the first aid training that they had given us during our initial training in the Army, right? The pre-assignment training, if you will. And all of this training, including the stuff I got in Germany, pretty much gave us trauma care for gunshot or shrapnel wounds, right? That was it. Trauma pads, how to control bleeding, including such wonderful advice as, if the trauma pad is not stopping the bleeding, kneel on the wound. What's the solution? Pressure, more pressure. Tourniquets are pressure devices. And even though tourniquets existed out there, we didn't carry them on our belts like they do today. Mm-hmm. The medic was going to really apply a tourniquet unless you went back to some main company area and got the larger first aid kit, and then there would be a tourniquet in there. But, we were given all the routine things, 3 to 4 inches above the wound, tighten it down, don't really, right the time, put a T on the forehead along with the time, etc. Never release it. That's done back by trained professionals. But that's the kind of training that we got. Also, we got training in heat and cold injury, how to recognize those things. First aid for smaller cuts, sprains, breaks, eye injuries, what to do immediately. Then there was a nuclear, biological, and chemical defense training, first aid training. So with all the indications for nerve agent, blood agent, etc. Or they told us about what the symptoms are for radiation poisoning. But the idea probably was you're not going to have to deal with that much, right? There's not a whole lot you're going to do.
Right.
Anyway, we had 2 auto-injectors that we were trained to use. One was atropine, and the other was blood agent antidote, but it was 2-PAM chloride, if I remember correctly.
Right.
And they also talked to us about STDs, not only prophylaxis, but the symptoms.
Oh, good.
Right. And we got to watch the movies with the horrible pictures. So in the late 70s, we're just coming out of Vietnam. Every day when I would walk the flower beds underneath the barracks windows, we'd find roaches or tinfoil from heavier drugs, harder drugs. And so, we had guys that were still looking for this. Now, it was maybe 5% of the troops. It wasn't like in Vietnam where you had a higher percentage doing drugs. But still, there were some drug users. And I think there was a lot of pot smoking or hashish use, probably more than 5%. But it never seemed to interfere with duty. Anyway, I say that because there was this mindset of getting high among a certain percentage of the soldiery of my era, the late 70s. And the reason that's important is I just talked about atropine auto-injectors. And we had to be real careful because we did have soldiers. There was this rumor out there that atropine was a great high.
Oh, no.
Oh, yeah.
Certainly that can't be true.
Absolutely true. In fact, there was a supply sergeant who got in a fresh supply of atropine auto-injectors that we were going to put into the NBC stores, nuclear, biological, chemical defense stores, because the old ones had expired. So he took one of these expired ones that were going to get destroyed, and we found him laying on the floor in the supply room with the auto-injector sticking out of his leg.
What?
I'm serious. Serious as a heart attack. Now, he recovered with some medical treatment, but
I'm just trying to imagine how that would possibly feel. I mean, I guess it's kind of like taking cocaine, but like the mirror image of cocaine. It's doing the same thing, but through a different mechanism, I guess.
Well, I have no idea because I never did it.
I'm glad to hear that.
We never had that problem, oddly enough, with the blood agent auto-injectors, because if you looked at the size of them, the blood agent auto-injector was huge, right? It was big, and the atropine injector was small.
Sure.
So I have to believe that must have played some psychological role in the fact that no one ever talked about doing it with the 2-PAM chloride.
Wow. They carry those kits on the ambulance here, by the way. Same thing, same stuff, yeah.
Yeah, well, I'm sure the Army got it from the general medical knowledge that's out there.
A lot of times it's the opposite. A lot of times when wars happen, that's when medical progress happens because all that crazy stuff happens out there, and then they take that and that goes back to the civilian world. So,
all right, I'll give credit to the
for sure.
Sure. Walter Reed, Panama Canal, lots of disease from mosquitoes. He figured out it was the mosquitoes and how to kill them and reduce that. So we named a hospital after him.
Wow. Okay. How about that?
All right. So 2 incidents I had while I was deployed on that tour to Germany. This is the late 70s. One had to do with what I have diagnosed as hypothermia. It may not have been hypothermia, and I'll give you the symptoms, the story and the symptoms, and maybe you can tell me, because I'm always interested. It was a winter compass course, so we had to take a compass and go find different places out there in the countryside. And we were on rough terrain, so you had to go up a ridge and then down into the gully and then up another ridge. So it was work. The temperature was about 25 Fahrenheit. it's an event that required a lot of stamina, even during good weather, and now we're out there in cold weather, which I kind of welcome because you can get hot and sweaty, right? And this made me feel better. After about 2 hours of jogging up and down the ridges to find these different points, my partner, because we went out in teams, just stopped. We were on top of a ridge. He stopped and just collapsed, sat down, Indian style, sitting on the ground. And I went up to him. I said, what's going on? You okay? His speech was slurred. He was only intermittently lucid. Didn't make sense. All right. He was surly if I tried to get him to move. He was combative. And then he would lapse into being non-responsive and very passive. And then he would go back to being combative. If he rested for a while, he became normal and we'd move on. And then it would happen again. And I'm not talking long time in between episodes. I'm talking about, we'd go 100 yards and it would happen again. So after the second relapse, I grabbed him, despite his combative nature, and just half dragged him toward the perimeter road. And when we got there, I knew there'd be a safety patrol coming around. When we flagged down the safety patrol, the sergeant in there grabbed a thermos, and he had my buddy drink hot water that he had put honey into. And we were lucky that he could get it down his throat. And then he seemed to be coming out of it and coming back to his senses. So, of course, the day was over for both of us. We got passing grades, but he went in and I went back with him. We had been out in the weather for a couple days. The breakfast we had was what was left over of MREs. It wasn't good. And we had probably drank about half a quart of water. We had 1-quart canteens, and I know mine was about half empty by the time this all started happening. So with those symptoms, what would you say it was?
It could be hypothermia just because it was cold outside. It could be dehydration. It could have been hypoglycemia. It could have been the honey that fixed him.
So slapping him was not going to help. Okay. I didn't slap him.
I mean, did you try that?
No, I didn't.
Did you check for atropine auto-injectors sticking out of his leg?
No, those stayed locked up unless we had an alert where they were,
Got
okay.
you.
So I got another story.
All right.
You wanted stories. I got a million.
Yes, absolutely.
This one has to do with heat injury. So we train in chemical protective suits, and they are hot because they've got thick fabric on two sides of a charcoal liner in between. And they are hot. They're hot in wintertime, and they were especially hot in summer. So Germany, it's 75 to 80. We're probably talking significant humidity. I mean, not like it is here in the summer in Alabama, but the humidity wasn't low, right? It's not like being in the desert.
Sure.
So we were in full chemical protective gear. That means you've got rubber boots on. You've got pants and a jacket that's made up of this chemical protective suit. They are closed at the wrists, closed at the ankles. You've got heavy rubber gloves on. You've got a protective mask on that you're breathing through, and it's got a hood, and the hood comes down and it anchors under your arms so that there is no wind that's going to come up underneath that hood unless it's a big gale. We didn't have it that day. So in other words, it's hot. This outfit's hot. I'm the officer in charge of training that day. I get called over to one of the stands where people are doing military tasks in all of this gear because a soldier has fallen down. He is on his back and does not appear to be in a good way. So I immediately ordered him to be undressed. They had already taken his mask off. So I made sure they stripped him down to T-shirt and skivvies, if you will. And so he's lying there, and I said, douse him with water, and they doused him with water. And I said, now take your anything you've got and fan him. I had assessed him prior to having him doused, and he wasn't sweating profusely. His skin might have been moist in that it looked a little bit shiny, but there was no obvious perspiration on him. So my immediate thought is dry means heat stroke, wet means heat exhaustion. And so we got him cooled off, the ambulance was brought around. I gave the NCOIC charge of the rest of the classes. I told them, call off the classes. You can have them go through the military tasks, but get everybody out of these uniforms, just regular uniforms. And I went back with the hurt soldier. When we get back to the dispensary, there is a physician's assistant on duty in the ER. And he takes my soldier back. I'm waiting there. He comes out and says, I think he's got a heart condition, heart trouble. I'm not sure he's going to make it.
Whoa.
If he's got family here, you need to get his family, his wife, here now, because I'm not sure that this guy, the prognosis, in my opinion, is not good. So I'm dressed in my uniform. I never took my suit off. I'm still in my NBC outfit. Masks off. I've got a weapon over my shoulder. Normally, you don't carry weapons around billet areas, family housing. So I take off because I know where this guy lives. I climb 3 flights of stairs. I knock on the door, pound on the door. Wife comes there. I said, you need to come with me immediately. Your husband's not well. He's in the dispensary. And they said he might not make it. We need to get you there. You got anybody that can take care of the kids? She goes next door. The kids get a babysitter, and we hoof it back to the dispensary. Now, by the time I get back there, a doctor, full medical doctor, had been called, and they had done some more tests, some more looking at him. And the doctor came out and said, well, it's not his heart. His heart is fine. He's dehydrated, and he has the flu. I wanted to find that PA and punch him.
Maybe a little bit of an overreaction.
Yeah, that could have been.
Yeah.
I was indignant. You know?
Oh, I meant the PA had overreacted, not you.
Well, you know, the doctor shrugged when I objected to that previous diagnosis and said that he thought the initial presentation made that a reasonable fear, but it was really just the flu exacerbated by dehydration. But I have to tell you, I never did live that down. You know, I'm the guy that panicked, you know, this dependent wife.
You were the messenger. Don't shoot the messenger, right? You were acting on medical advice.
When you're the officer in charge, everything that happens or doesn't happen is on you.
Oh, I see.
So I never did live it down. At the end of my tour, they wrote up a scroll of all the funny things that happened during your tour, and that's certainly in my scroll, my going away scroll.
I guess you'd rather it be funny than the guy was right and he died.
Well, yes.
Yeah.
I'm happy that he recovered and we didn't lose him.
Right.
I have a story about psychosis.
Okay.
So in the barracks for an entire weekend, a soldier of mine sat in an easy chair on the 3rd floor staring out the window. His roommates told me on Sunday, they finally called the CQ, charge of quarters, the guy in charge of the quarters when there's no one else around, right? They called him. He called me because it's my soldier. I came in, and this guy didn't look good. So we called our version of 911 and got an ambulance over there. The soldiers, his roommates, told me he had sat there. He hadn't eaten. He hadn't drank anything. He stared out the window. I suppose he blinked, but they wouldn't even admit to that. They said they had tried to talk to him. He wouldn't say anything. He just stared out that window, not happy.
Yeah.
So we sent him, the medics then at the hospital, doctors, sent him to Landstuhl, which is the major medical center in Germany at the time, where they've got all the specialists. And a couple of days later, I go up to visit him, and the psychiatrist tells me that he's got a classic case of schizophrenia. And I said, how are you sure? Because, you know, this guy had always been fine. And he said, no, he says, this guy is classic. He says he's too classic for a layman to have faked these symptoms. And I said, do you have any, is he talking now? He says, yeah. Do you have any idea why, you know, what happened? He says, well, the story we get is he was visited by space aliens who told him that if he talked or interacted with anybody, that the aliens would come back and kill them. So he was trying to protect his buddies.
Wow.
And he did.
That puts 2 new spins on the whole situation.
Yeah.
Yeah.
So he was sent directly back to the States, and I'm forever grateful to him because I'm still here. Yeah. Yeah.
Thank you for your service, wherever you are.
That's right. Before flight school, the last story I'll tell you is one of discretion. It's peripherally medical in that a soldier died, but it really has to do with discretion post-mortem, right? And I'm not talking about just respecting, the dead body instead of, posing for pictures. No, that's not what I'm talking about. A sergeant died of a heart attack, and he got immediate medical attention, but he was gone. So now comes the survivor assistance business. And I was on the roster, and so I'm supposed to pack up his gear, inventory his personal belongings, send everything back to the States, do all the paperwork I can do to help out the widow and the family. The military's very good about this. Going through his gear, his billfold, one of the things I found was a picture of a naked woman in a very compromising pose. Now, he was over in Germany unaccompanied, meaning his family had stayed back in America, and he was over there, and this is most likely his wife. But I asked myself, am I going to pack this picture up and send it home? So what would you have done, Jody?
What would I have done? I'd like to think I would have thrown it in the trash.
Oh, I did better than that. I burned the darn thing.
Okay.
It can be found in the trash. Yeah.
Sure.
So I burned it.
Well, I feel like whether it was or was not his wife, either way, it can't be good, right? It's not going to be good.
So, I mean, for your podcast, in my mind, the lesson here would be that care goes beyond the simple medical treatment that you give.
Oh, absolutely.
Yeah. And I have nothing more to say. That's the story, and that's the lesson.
Well, I've told a story on this podcast before about when I was a kid myself. I was a 19-year-old intermediate EMT, and we ran this horrible call where these kids, not much younger than me, got killed, and just awful, in a small town where everybody knows everybody. And one of the things that had ended up left in the ambulance was this bloody shoe. And I should have done the same thing. I should have chunked the damn thing in the dumpster and moved on with my life. But I was like, no, I have to take it back. And I marched my tail into the funeral home. Hey, I got this, stupid, just dumb.
Yeah, but what makes you not dumb is it was only one time.
Well, I don't know. I'll consider that as we're talking. Hopefully it was only just one time.
So my tour's wrapping up in Germany. It's time to go to flight school. I'd applied and been accepted, but I had to have a flight physical to round everything out because the acceptance is provisional, right? So flight physicals are far more thorough than the normal physical, which a soldier in those days got once every 5 years, unless something had happened to you. Flight physicals you got every single year, and the first one was absolutely the most thorough physical I've ever had in my life. I don't know how much blood they took, but I know they put me through a battery of tests that were so numerous I've forgotten half of them.
Sure.
No, I mean, poking and prodding and going and coming. Anyway, the flight surgeon was concerned that I had a deviated septum. The limit was 50% occlusion in one nostril. And this flight surgeon kept looking up my nose and looking up my nose. He did it 3 or 4 times, looking back and forth. And finally he says, I'm going to call that 49%.
Perfect.
Perfect. You know what the tool he was using. It has that little black tube that comes down to something small enough to fit up your nose like a funnel.
Right.
And then it's got a light. Well, that's all he was using. There were no x-rays or anything else. So eyeball estimation, I passed with 49% and a warning that they're going to reevaluate my records at Rucker, not necessarily call me in for another physical, but they'll review my records. And those flight surgeons may not be as willing as he was.
Okay.
Anyway, I was allowed to enter flight training after the subsequent record screening. So I have no idea how all this stuff works, except I slipped through when out of a class of 50, we had 5 of them, 10% that were washed out after that subsequent records review. So I know they actually did take a look at things.
Okay.
And so I feel very fortunate because I went on to fly unpressurized aircraft at very high altitudes, and a deviated septum could have been significant. Turned out it wasn't, but it could have been.
Sure.
Anyway, I already told you they warned me they found the varicocele and warned me that I might not be able to father children. Of course, I have 2 healthy children, but there were a number of women that never got pregnant, so I don't know. You know,
I don't have anything to say.
all right, during the first 2 weeks of training, you go through what's called AeroMed. It's a classroom training. And in AeroMed, they warned us that we would develop an acoustic notch in the frequencies that human speech occupies. This is even though we would wear earplugs, even though we would have a helmet on that had a seal that went around our ear, like earmuffs. And if we kept the seal in good shape and we wore our earplugs religiously, we would still get this acoustic notch.
Okay.
They were right. Did you know that? Those guys had it figured out. They also told us that half of us would end up with hemorrhoids because helicopters, now this is their thinking, helicopters give you a vertical bounce. And since you're always bouncing vertically, if you get enough flight time, they said, you're almost certain to get hemorrhoids. And it's true. I know half of the aviators I know have hemorrhoids. The other half, I think, don't admit it.
Right.
And I don't understand the mechanism. I'm not asking you to explain it to me here on this podcast. But I will tell you, we went through all of that.
Sure.
And they went through the effects of high altitude and low altitude. Not that helicopters fly at the highest I've ever been is about 15,000 feet in a helicopter on oxygen, right? But, we went through all of this.
Mm-hmm.
Spatial disorientation versus vertigo. Pretty thorough class, I think.
Yeah.
So after all of AeroMed and getting out of flight school, I had a turnaround course from helicopters. I went into twin-engine airplanes. Those fly intelligence missions mostly in the Army. Very few VIP, passenger aircraft. The missions that you fly are at high altitudes, over 20,000 feet. And I went to Korea in this unpressurized aircraft called an RU-21H. And we went up to altitude to well over 20,000 feet. And then there was a problem with our radios in the back. So we went back down to sea level. And the problem got fixed by the mechanics. We took off again and went back up to over 20,000 feet. And then there was another problem. And so we started to come back down. And during that second descent, both me and the other pilot were feeling stiffness in our joints and a little bit of what I'll call mild pain. Now, we self-diagnosed that as the bends.
Right. Just like you'd think of with scuba diving. Yeah.
Right. Flight surgeon looked at us and said, well, you may have had a mild case. He says, but you're not going to fly for the next week regardless.
Sure.
And they just put us, grounded us, and we didn't fly. And it changed the procedure. You were allowed to go up, come down, and go back up one time. And if you came down, you had to come down much more slowly than we did. We just nosed it over and essentially dove for the ground because there was a mission we were trying to get online.
Sure. Is that typical for military pilots to do both rotary and fixed wing? No.
You get a small percentage. It might be 2 or 3% that go through airplane training, fixed wing training, we call it. The only reason I went to fixed wing training is because they lost my records at DA when they were doing assignments, and the only thing they had left was an airplane assignment.
Wow. Okay.
One of my assignments was out in the Mojave Desert, where I was with an RDT&E activity. It was Army, but we were stationed at Edwards, where I actually got to support the second and third shuttle landings.
Wow.
In a helicopter doing security sweeps to keep the crowds back. But that's not medical. So yeah, I'll tell you that story offline.
All right.
After about 2 years in the desert, I started to develop allergy symptoms. I'd never had allergies before. Now I'm getting sinus problems and et cetera. I went to see the flight surgeon. He asked, how long you been here? I said, 2 years in the desert. He says, yep, right on time. He says, after 2 years of chronic exposure to a dusty environment like you have out here, it's very common for people to develop allergy. He says, but the good news is they're only going to get worse as you age.
Thanks.
I said, oh, great.
Has that proved to be true?
It has proven to be
Okay.
true. He says, once you've been sensitized to any allergen, the likelihood of picking up additional allergies, becoming sensitive to others, are much greater. And so it's turned out to be true for me.
Got you.
One of the symptoms I had was I began to have lymph nodes that would swell up. And that's really why I went in there. I could have probably dealt with the head cold type symptoms. And I showed him that here on my right groin, there is a lymph node, and it was swollen. Didn't hurt, but it didn't go down, right? Didn't resolve. Resolve, see, that's a medical term you guys use. So I said, this is really what brought me in. And he says, yeah, let's take a look at that. So he gets me on the table, my drawers are around my knees, and he's palpating.
There you go.
There you go, another term.
Yeah.
And he's pushing here and there, and he says, I really want to check this out. I need to get invasive on you. We're going to aspirate. So he has a nurse come in, and they have a needle and a syringe, and he, with no anesthesia at all, no anesthetic, he sticks that needle into this lymph node. But as he's approaching me, I asked about anesthetics. He says, no, this should be okay. I won't be in there long. I'll remember those words for the rest of my life. I won't be in there long. So his first attempt, because he pulls back a little bit on the plunger, nothing. So he moves it around. He says, well, let me try over here. Moves it around. And after 2 or 3 attempts, he's convinced that it's a dry hole. He's not going to get anything out of it. That's it. So he pulls it out, slaps a bandage on me. He says, don't worry about it. If it gets larger, it starts to hurt. I said, it hurts now. He says, well, it won't hurt in a couple of days. He says, then come back. Well, it never did. Never went down. That's, like 35, 40 years ago. Still there.
Wow.
It's been seen by multiple doctors, and all of them say, well, okay, no big deal. If it hasn't bothered you up to this point, must be fine.
Sure.
You know that every year an aviator gets a thorough examination, right? So every year I got the finger wave, right? The prostate exam.
Sure.
Fortunately, they all turned out well. How they know it was within normal limits, I don't know, because I've never given one, been trained on it. But they seemed to have an idea what they were doing. So I probably have 23 years of flight physicals. A lot of flight surgeons have been intimate with me.
Sure.
And that's guys that are regular size and petite females. And then one day I walk in, and there's a guy that looks like a linebacker for the New York Giants. I mean, he was literally 6 feet 6 inches tall, and every other part of him was properly sized, right?
Sure.
He made me feel like a Lilliputian. And he is doing my flight physical, and I'm just waiting for that moment. Now, the reason I include this story is because out of 23 flight surgeons, this guy was the gentlest,
All right.
was the best. It was just a great experience.
Okay.
And I don't mean that in any other way than it wasn't unpleasant. No, I don't mean that either. What do I mean?
It was the least unpleasant.
Yeah, it was the least unpleasant, and I guess that proves that it's not the size, it's really the skill.
I guess it does.
Yeah. All right, rapidly, let's move on. I had an incident with a blood draw. I went in for a routine physical, right? Flight physical. I'm in an Air Force hospital. I say that because I know this would never happen in an Army hospital. I'm in an Air Force hospital. They need to take their lumps. A young female airman phlebotomist. So I'm in the chair, my arms extended, got the strap on. She comes up to begin her blood draw, got her needle, and she pushes it into my arm, and I almost instantly have a pain that goes down to my fingertips and up to my shoulder and will not stop. And I groaned. I didn't scream. I didn't cry. I went, oh, that kind of groan.
Yeah.
I looked down at my elbow where the needle is, and there's a little bit of blood coming out around the needle. something ain't right, because I've had a lot of these. That's not happened before. The needle is sticking out of me. She's backed off, with her hands in the air.
Okay.
She was young. She was young. She was an African American, and I swear she was looking white. She had turned that gray.
Sure.
So I suggested to her, as she's standing there, staticus dramaticus in full, effect, I said, maybe you should call the sergeant. So she gets the sergeant's attention. He comes on over. He takes one look, and he says, Jones, we talked about this. What's wrong with that picture? And she says, the angle? And he goes, you bet. Now pull it out and do it right. So she pulls it out. The pain subsides. And she sticks me correctly this time and gets the blood draw.
Nice.
Do you know what I got for that whole thing?
Nerve damage, neuropathy.
I got nothing except a Band-Aid. That was it. The sergeant didn't say anything. Airman didn't say anything. It was a different world back then, huh?
Yeah, for sure.
Just, okay, you're done. Out.
Yeah.
Next.
Well, and clearly it had happened before. I would love to know how many times.
Well, I don't know. I'm sure this particular phlebotomist never had that happen again. I've never minded being a training aide if they learn.
Sure.
And I think she learned.
Well, the comment about, we've talked about this before, made me think maybe you weren't the first.
No, you're right.
Maybe you were the last. Let's hope.
Right. I hadn't thought about that. But you're right. But that's what he said. Korea, flying high, unpressurized aircraft, hypoxia. So I'm over the DMZ. We're well over 20,000 feet. When you're that high in an unpressurized aircraft, you have to have positive pressure blowing air into your lungs, or the partial pressure of oxygen in your bloodstream will cause you to breathe out oxygen. All right?
Makes sense. Yep.
So you have to have positive pressure going in. This is why jet pilots, when you hear them, they sound so funny, because they're having to talk against all that wind that is being pumped into their lungs.
Got you.
The seal for the mask, the oxygen mask, is pulled so tight so that the air goes into your lungs and not out by your ears, that you will spend the next 12 hours, once you finish, with a ring around your nose and mouth. You open your mouth and your lungs fill. You don't have to breathe. So, we're up there, and you're used to your diaphragm not having to do the work it usually does, because it's being pushed out of the way by the stream of air blown into your lungs. Oh, by the way, I remember hypemic, hypoxic, and stagnant, the three hypoxias they taught us about.
Okay.
Right? Hypemic, not enough blood cells to do the work to carry the oxygen. Hypoxic, not enough oxygen to ride the blood cells. Stagnant, you got plenty of oxygen and blood cells, but you're not letting it move around the body, right?
That's a good way to think about it.
Yeah. So anyway, in order to discover what your personal symptoms are so that you can recognize them, they send you to an altitude chamber. And in that altitude chamber, they take you up there, you take your mask off, and then you figure out what symptoms you have. Most symptoms are similar, but they're not all alike. Some people can have, some others don't. So the story is, one evening during pre-flight, my partner, my co-pilot, got interrupted by a crew chief who had a question for him. And when he finished dealing with the crew chief, he came back and picked up where he had left off, he thought. Unfortunately, he had missed an important step. We had 2 oxygen canisters in the aircraft, big bottles. He had to open the valves on each of them, right? Because you were going to use 1.5 or 1 2/3 during any given flight of our duration. Well, he had thought he turned on both of them, and he had not. Well, that's a problem. So during the flight, I noticed that it was getting a little harder to breathe. By harder, I mean I opened my mouth and it wasn't instantly filling my lungs, which, with the experience I had had of months and months doing this, was a normal thing you were expecting. So I was a little concerned. All right, so I whipped off my glove and I looked at my nail beds. They were starting to look a little bit bluish. And I was starting to get very mild tunnel vision. It wasn't severe, but I noticed that I was having to turn my head in order to see what should have been in my field of view. And my eyes were starting to shake a little bit, my vision. And one of my personal symptoms was that my eyes would shake just slightly, making the world look like it vibrated just slightly. And so knowing that your time of useful consciousness at those altitudes, even without explosive decompression, is going to be 30, 40 seconds, I instantly gang loaded the oxygen regulator. 3 switches, you threw them up, put you on an emergency oxygen bottle, and 100%. Prior to that, we had been what they called diluter demand, which mixes ambient air with the nitrogen with the 100% oxygen coming out of your tanks to give you the correct blend. Well, you don't play with that when you think you might have an oxygen problem. So I gang loaded, told my co-pilot to gang load his, he did, and our symptoms disappeared. Now it's time to troubleshoot. And so I reached back behind his seat where the 2 bottles and found the issue. Turned on the bottle, full flow restored from normal sources, reset the oxygen regulators to diluter demand, and we finished the mission. But that is one of those incidents, it's like when the Koreans called out our position and told us if we didn't turn to a certain heading, they were going to fire at us.
Yikes.
No medical story there, unless you want to say hyperventilation.
Sure. How much time do you have on those oxygen bottles?
Depends on how high you're flying and how excited you get.
Okay.
No, but really how high you're flying, because you'll use more of the 100% oxygen the higher you go. So if you're down low, not as much. The diluter demand calculates that for you and adjusts the mix so you get what you need.
Is that a rate limiting factor in doing a mission like that, or you have way longer air than you have fuel or whatever?
Well, I would say in that particular mission, they're roughly equal.
Okay.
But our missions were normally shorter than the air supply we had on board. In those days, we were flying about 3.5-hour missions. We could stay up longer, but I don't remember any mission pushing much past 4 without them launching a secondary aircraft to take over if they were that interested.
Got you.
So we came down. I will tell you, other than that mild case of the bends, I don't ever remember any effect on me. We were never affected by flying at those altitudes other than that telltale mask imprint around your face.
Sure.
That was about it. People did go up on subsequent days, though I think we had a policy that said you weren't allowed to go to altitude more than 3 days in a row. For reasons I don't know. And I don't ever remember going more than 2 days in a row without a break.
Okay.
Time to go to war. Operation Desert Storm. Before you deploy to a combat zone, you will get a screening. And this screening is more than just medical, but it includes a medical screening, but it's not a physical of the type we've been talking about.
Okay.
But they'll go through and might check your vision because it's easy to do. And they'll make sure you've got a second pair of eyeglasses. And we're talking dog tags and insurance, your government insurance, that your will is up to date, all sorts of things. You've got proper gear. And it's usually done in an auditorium or a gymnasium where there's a lot of space. And there is no modesty in these places. There were no screens. So the medical screening, which included an inoculation station, was just out in the open. Now it was up against a wall. And so, if you will, the screening was that you would turn around when you're going to get your shot with your back to the wall so that everybody else out there they could look at you, they could see you bending over that table.
Mm-hmm. Sure.
But they weren't getting the eyeful that they might have otherwise. So, you ever heard of RUMINT? You've heard of SIGINT, signal intelligence, or HUMINT, human intelligence? RUMINT is rumor-based intelligence.
Okay.
And it had flown throughout the unit that gamma globulin was going to just put you down for 2 days, right? It was going to hurt going in. It was going to hurt for 2 days after, and it turned out that wasn't the case. you could feel it was cold going in. And it was a pretty big needle and a pretty big syringe. And that was the last station, by the way. So when that station was over, we were ordered to go out to the track adjacent to the gym and do a half mile on the track. And they didn't care if we walked or if we ran, but we were going to do a half mile of exercise out there. The next day, I had no issues whatsoever. And I don't know of anybody else I ever heard complain about their shot. They joked about it, but they didn't complain about it. So for whatever it's worth, I thought I'd pass that on to you.
I've heard the theory that it's good to move whatever muscle you get inoculated in to help work the soreness out. I mean, it makes sense.
Yeah, or to make it spread out, absorb.
Sure. More blood flow, right?
So, okay. Hazards of being in a desert theater. Scabies. Wonderful scabies. So, pre-combat phase. I'm part of the advance party to help set things up. And when I get over there in late October or early November of 1990, there was no shooting going on, and I'm in a rear area at that point on a Saudi air base or military base. I went down to their little bazaar, me and a buddy, and we bought prayer rugs. We packaged these up and shipped them back to Germany, where both our families resided. And we thought, what a great gift. We both had young kids that were 5 or 6 years old and younger. Those rugs contained scabies.
Wow.
So my wife and his wife, they took the kids to the doctors, and the doctor says, yeah, that's scabies. Here's some cream. Here's what you do. Didn't work. Took them back. More of the cream. Didn't work. Whatever these scabies were, that cream was not the answer. So a particular doctor, I think the third or fourth one that had consulted, said, you know what? Let's look into this. And he determined that they were Norwegian scabies. Now, what you need to understand is, despite the name, Norwegian scabies are not found in Norway. I don't know why they have that name, but they are found in Saudi Arabia.
Okay.
And they are not susceptible to the drug or cream that was being given, that medication. These were, the proverbial zebra, not the horse.
Yep, you got it, right?
So they got that all solved, and there were no problems after that. They got cured.
Nice.
All right. Amoebic dysentery. I got one of them stories.
Oh, man.
So the military goes to great lengths to avoid this.
I would think so, yeah.
Right? And we have Army veterinarians. I don't know if they're actual vets or if they're just called vets. I suspect they're actual vets because I think on Army posts, you can take your pets there.
Okay.
Right? So they probably are actual vets, but there aren't many animals in the Army.
Mm-hmm.
So they do a lot of work with foods. Your food sources, especially fresh food sources, are inspected by the veterinarians to make sure that they're healthy. And water is tested under their auspices to make sure it's potable. So in this theater, the war had ended, and we are now sitting around for months waiting to go home. And the command, of course, everybody wants good food that is not MREs, nor T rations, which are, think of a pre-made steam table rations.
Okay.
Right? That come out in heavy aluminum pans, just like a steam tray. Yeah.
Sure.
And they're okay, but they wanted fresh food.
Mm-hmm.
Vets are in charge of fresh food and in charge of the warehouse where all the vendors would bring that food. Well, something went wrong. They think it was the salad material, the lettuce and such, that was delivered to us. And people started to get the runs. And not just ordinary, I've got the cold or flu. These were, somewhat explosive, ongoing. We started to have concerns of over dehydration, etc. 1,800 people in this brigade, not all of them had symptoms, but enough had symptoms that we were clinically diagnosed as having dysentery, amoebic dysentery. Of course, that rippled on up the chain. The vets took note, and I don't know what they did, But I know that our brigade stopped eating fresh foods and went back to these prepackaged things. And probably a quarter of the brigade, maybe a third of those 1,800, came down with symptoms, not all severe, but all told not pleasant, right, if you've got those symptoms. The reason for it, they finally figured out, was a different kind of bug, just like scabies.
Okay.
And the Army Technical Bulletin, TB Med 530, I think, I'm sure there's some soldier out there that was involved in food service and will tell me, no, sir, you got that just wrong. But okay, it's a number of years ago. There is a procedure for treating salad materials, lettuce and vegetables. It consists of a certain solution that has a certain concentration of chlorine and for a certain amount of time at a certain temperature. Right? Makes sense. That's what you would expect. And this bug wasn't killed by that. So they had to put out a notice to the theater, to all units to change. We never went back on fresh rations. The brigade commander, and I think most of the rest of us, said, nah.
Not worth it.
Not worth it. We'll spend the next 2 or 3 months eating what we call B rats.
Okay.
So you've got C rations, B rations, and then A rations are the fresh food. And the B rations are the semi-fresh food that are in the trays in between.
Do you know what the new process was that they had to implement?
I'm sure it was a greater concentration for a longer time.
Okay.
But I never found out because we pulled away from all that and went back to doing what we did, which was baking sweet rolls and yellow sheet cakes with sugar icing, because that was trading material to get what we wanted as we were sitting there.
Yeah.
All right. So anyway, what was the treatment for this? Because they did treat us for it. So have you heard of Flagyl?
Yes.
So I'm not sure what constitutes a single treatment dose or course, a regimen of Flagyl.
Mm-hmm.
They came and told us that they were treating us with a triple strong dose of Flagyl. So if you're supposed to take 1 pill a day, we were taking 3 pills a day.
Sure.
You actually had to look in some soldiers' mouths to make sure they were swallowing these things after about the third day, because it made you sick. It was like, I'm sure this is chemotherapy writ light.
Sure.
Right? You walked around queasy for the next 2 weeks or so, mm-hmm. because you were taking, this triple dose of this medicine. And it wasn't the preferred medicine. They weren't sure it was really going to kill the amoeba. They had a preferred medicine. It was in the States, had to get shipped over. It didn't get there for about 2.5 weeks. When it got there, they brought it down, and we got a double strong dose of that medication. Okay, tell you what, we got better. We no longer had people that were sick. But for the next 2 years, I couldn't eat spicy food. And everybody that I knew and stayed in touch with, which was, probably 24 people from that unit at that time, had the same problem. Couldn't eat spicy food. Even without the spicy food, every month or two, I'd get this acidy kind of stomach, and I might even get the runs for, a day or two. So it damaged the stomachs of everybody that took this stuff. But it all tapered off over time. I now eat spicy food just fine. But it took a couple of years before I was willing to approach spicy food. But that wasn't the worst side effect. Even though it was only 2 out of about 1,800 soldiers. We had 2 soldiers that lost the feeling in their thighs and all the way down to their toes.
Wow.
So from mid-thigh down, they couldn't feel anything. Now, after several months after this, their feeling gradually returned, but not whole. We're talking about they began to feel something, but they weren't cured. They weren't normal yet, okay? And they rotated out of the unit, and I lost track of them, so I don't know whatever happened to them. But that was attributed to this regimen of drugs that we had taken.
Wow, gotcha.
Saddam Hussein set oil wells on fire. So the smoke drifted downwind in what we call a downwind hazard area. And the sky would be hazy, and you would find residue on vehicles, etc. So the chemical smoke was reported to have had ill effects, but they were hard to pin down, apparently. But I know that DOD tracked and monitored units that were in the downwind hazard area. And for years, probably 15 years after Desert Storm, every so often I would get a letter from DOD reminding me I had been in this hazard area and then giving me statistics on people that had been in the area versus general population. So I think they were trying to figure out what Desert Storm syndrome was.
Sure.
Right? If it existed, because they're going to play by the statistics, right? Some statistical comparison. The fact that you might bring in a patient and he says, I was there, and he's got symptoms that reasonably could fit that kind of chemical exposure is not good enough. It's got to be on a population basis.
Okay.
Now, whether that's right or wrong is not up to me, but I'll tell you that they kept coming back and telling me that there is no higher incidence of anything in your population than in the general population. So for a long time, claims were denied by veterans. Eventually, the VA began to recognize Operation Desert Storm Syndrome, and I guess that's good, but I can tell you I never had any effects, even though I was in there and, the oily residue and et cetera.
Sure.
Must be my good genes.
That's great.
Almost as an aside, just because it's part of military medicine, the U.S. Air Force had medical tents that were just, I want to live in these things. They were double-walled. They had floors. They had air conditioning, and they had an overpressure system to keep the dust out. You walked into an initial chamber, if you will, an anteway, where you could dust yourself off, jump up and down, and the wind would be blowing by you to the outside. And then you could come in through another set of flaps to the interior. And I'm sure it didn't keep 100% of the dirt and dust out, but boy, I'll tell you, it's a whole lot better than Army tents. When we would have sick call, I don't think I saw any soldier malinger over there. They were all aware of the importance of the mission, and nobody shirked.
Sure.
But when they did have a legitimate reason to go to sick call, they were not unhappy. They didn't hesitate.
Sure.
Task Force Sandhawk is a task force that I commanded while I was over there, and we collected prisoners of war. That wasn't our mission. We just happened to collect a bunch of them, because the Iraqis really were pretty beat up by the time we started the ground war. So I had a number of soldiers, and we would watch the front, and then these Iraqi prisoners would walk through their own minefields to get to us.
Wow.
Days prior. They had been in artillery duels with the 1st Cav Division, and then I took over the 1st Cav sector with this small task force to try to stop anybody that might bring an armored column south to hit the main supply routes.
Okay.
Right? So we were really kind of a tripwire. But what ended up happening is we collected around 300 enemy prisoners of war. The weather that they wandered through was roughly 40 degrees Fahrenheit, a little colder at night, maybe a few degrees warmer, let's say 40. It was always spitting rain. It would either rain on you or it would spit at you with drizzle. The clouds were low and fast, scudding clouds. So this is breezy, rainy, bad weather to be camping outside.
Sure.
I had tents. I didn't have tents for prisoners. I had to strip part of the perimeter wire, my defensive wire, to make a cage, just a 4-sided cage of concertina, so that they knew where not to go.
Sure, yeah.
Right, so they could stay in there. They came through their minefields in terrible shape. No weapons, no coats, some of them. Some had, some didn't. Oh, I'll say 10% had no shoes, when they came at us. But all of them had propaganda leaflets that showed them sitting around a big tray of fruits with smiles on their faces. Good propaganda,
Sure.
you know,
Yeah.
when they're carrying that south with them. But now I've got them in these awful conditions where they're always damp. And what do? I got to prevent hypothermia. This was what I call a CNN effect, right? I was going to make sure CNN didn't have anything bad to report about the way I handled these prisoners.
Mm-hmm.
And hypothermia was the big risk. Would you agree?
I would.
Yeah, I would too. You know what they'd been eating for the week prior? Raw flour mixed with rainwater they got out of puddles.
Wow.
So it's muddy rainwater.
Yuck.
I know.
Yeah.
For a week prior, that's the only food that they had had. I had two Kuwaiti students that were my interpreters. So I'm trusting they told me the truth about that. So we had latrines where excrement went into a cut-off 55-gallon drum, the sides of which maybe were 18 inches tall at most. And then they had a couple of handles welded on the side. And you would use diesel fuel or gasoline to burn that excrement every day. Well, we burned those things out, and then we filled them with sand, and we had 4 of them. Because I'm a little task force out here. I had 300 people, infantry company, and some tanks. So I didn't have a whole bunch of need for latrines.
Right.
So we went without latrines. We actually dug holes the old-fashioned way for the 36 hours or almost 48 that I had these guys. And for the 2 nights that they were there, they had fires. 300 of these guys, 6 of them sat around one fire, and all the rest split the other 3 fires. So I grabbed one of my interpreters because I'm now worried that I'm going to have 6 guys live and a bunch of people that are going to be dead tomorrow morning. And these were the officers. We had a Republican Guard lieutenant. We had a reserve captain who had fought in Iran-Iraq War and was now recalled. According to the interpreters, Saddam's regime had threatened his family if he didn't come back in because he had actually finished his obligation.
Got you.
They had recalled him forcibly. Then the other officers were there. They were lieutenants too. And so I had my interpreter tell them, you need to share this fire. All fires need to have the same number of people. Give everybody the best chance to make it through the night. And they looked at me and objected. So I told my interpreter, you tell these 6 officers, if they don't do what I've said, I will take them away from the fire. They will not have a fire. The way he interpreted that was to them, because their eyes got big. They stood up. Their eyes are big. They're gesticulating. And then they accepted. I said, what did he say to him? Because I had 2 interpreters. So what did your buddy say to him? He said, you take them into the desert if they didn't obey. And he said, in our culture, that means you were going to shoot them.
Oh, okay.
If you took them into the desert, that was a euphemism for doing away with them. So they did split the fires up, and I did not lose anybody. But they were hungry because I knew they had to have calories to help. So I stripped all the MREs I had and took the ham out, right, the pork,
Sure.
MREs out, and gave them the MREs. Now, I knew from remembering World War II and the concentration camps, you can't give people that have been malnourished rich foods, heavy foods right away. You have to bring it in slowly.
Right.
Well, I had no way to introduce this slowly and no good way to really communicate that. So we had a bunch of regurgitation, I'll call it.
Okay.
Not all of them, but I'll say a quarter of them puked. So I brought out the ham because that's all I had left. The ham MREs, and the interpreter said they'll take it. Allah will forgive them.
Make an exception. Okay.
Make
good.
an exception.
Yeah.
And so they got this. And the second round, there was less, but they had learned how to go slow.
Mm-hmm.
I think they had gorged themselves on the initial because they hadn't eaten anything good in a week.
And those MREs are very calorie dense.
Very calorie dense.
Yeah.
There really is no more to that story, that part of the story, except that I introduced the foods way faster than they should have been introduced. but there was nothing I could do.
You also took the best care you could of those prisoners, which is admirable, I think.
Once they're no longer a threat and under your control, we're obligated. It doesn't matter if the other guy's obligated or not. We are.
Sure.
We're honor bound.
That's very admirable.
So now comes the story that has haunted me for a long time. Even though I feel no guilt about it, it's something I think about frequently. It is actually one of the reasons I have come back to take church more seriously.
Okay.
They say there's no atheists in foxholes. It took me a little while for that to kick in.
Okay.
And it was well after the war. But it came from this. One of the prisoners, on the morning that the evacuation, the POW buses were going to come and take them back to the POW compound where they'd actually get their fresh fruit, like the flyer said. We had a comatose comatose soldier on the ground. So I had the infantry point a lot of guns at the rest of the soldiers that were in there, had them moved back. And me and one of the medics went into the enclosure to check on this soldier. And the medic said, "Sir, I think he's got a traumatic brain injury. Look at his pupils." Now, a detail that escapes me after all these years is whether they were pinpointed or blown, or one was one and the other was the... I don't remember that exactly, but the medic felt whatever they were was significant. And his training had told him that, and so I trusted him. We got a brain problem here, most likely. But I wanted to make sure this guy was safe before I took him outside the compound and gave him a chance to hurt somebody. Because when you're collecting prisoners at night, all night, even though you try to search them, there's 300 of them. There's no guarantee that you've done a thorough search, especially if some of them have coats and thick clothing. And this guy did. So I could have tried to search him right there, but I wanted to know what I was dealing with. And I said, "How do I know for sure?" And he said, "Well, let me show you." So unbuttoned his jacket, bared his chest. His nipples are exposed. The medic laid down across his shoulder clavicle area so that the guy's head is in back of the medic. And the medic has a needle in his hand. And the medic's watching the guy's fingers or something. I was told to watch his face for any kind of movement. And the medic jabbed the needle into the guy's nipple. He did it on both sides. And there was nothing. Nothing happened. He didn't flinch. There was no shivering. There was nothing. Not a scintilla. So I said, "Well, you must have been right." So the medic says, "We need to medevac this guy. Let's call a helicopter in, sir, and airlift this guy out." Well, right at that moment, I happen to know, because we're in contact by radio with the general situation, I happen to know that the Battle of 73 Easting was just kicking off. And if you know anything about that battle, it's one of our divisions going against a Republican Guard division, which were their elite forces. And that Republican Guard division was dug in to defensive positions. And we had no idea how good we were going to be or how much of a fight. Is this an equal fight or an unequal? It turns out, fortunately for us, it was an unequal fight. Nobody knew that at this time.
Sure.
So the potential for large numbers of casualties was great. Helicopters don't carry that many people, right, in medevac role. 4, 6, maybe you can get on there. 8, maybe, but not that if they're laid out flat. And they've got a ways back and a ways to return to get more. And those medical facilities, the MASH, if you will, was not going to be following on very close. They're a little ways in the rear. That's a problem for me. I am not, in my conscience, going to tell an American mother her kid died because he didn't get to that MASH, just because this guy is laying on the ground. He would have killed me, a week and a half ago if he had had the chance. And even though I'm going to treat him as best I can, when push comes to shove, I'm going to prioritize, American welfare.
Right.
But if he is going to die instantly, that still is a problem. It's one of those gray areas. I've got an ethical conundrum here I got to solve.
That is, yeah.
So I asked, what are his vital signs? So the medic had taken his vital signs. He says his respirations are good. His pulse is good and strong. His blood pressure is good and holding. I said, well, is he going to die if we put him on a bus and he has to ride for 3 hours back to medical treatment? He says, no, but his brain might never recover. He may be a vegetable for the rest of his life, or he might die from that brain injury later. I said, but he'll make it there with his heart beating. And he said, yeah. I said, he goes on the bus. I'm not going to divert a medevac chopper for him. So that's playing God. Would I do it again? Same decision, absolutely.
Yeah.
Under those circumstances. So now you're going to play this podcast. Somebody out there is going to send it to DOD, and I'm going to get hauled up on war crimes. Yeah. 25 years later.
Surely not.
Probably not.
I don't know. It's hard for me to imagine that anybody would question that.
Yeah, well, I'm not truly worried about it.
Well, even just from an ethical, moral standpoint, I mean, what else could you do?
I don't know. I'm not the only one that's had to make those kinds of decisions.
Right. Oh, of course. Right.
It's not unique to me in my situation.
Right.
Hell, I told the Saudi colonel that had an armor brigade that had a border with me. If you drop your tanks down in that wadi, you look like Soviets. I'm going to kill those tanks.
Mm-hmm.
I own that wadi. You stay out.
Yeah.
We would have shot him. It would have been a blue-on-blue engagement, but not one that I could take the chance. I could risk those being Iraqis that had infiltrated that far south.
Sure.
So you got to make these decisions.
Right. Yeah. And I wouldn't consider that playing God either. I mean, you did the best you could to get him some help under the circumstances, right?
Well, now, I've always kind of enjoyed thinking I played God.
I should point out we are recording in a church.
Oh, yeah.
Did the power just go out?
All right.
But seriously, I mean, just in my experience of occasionally you do make a decision that stays with you. You wonder if you should have done something different or whatever, but nothing about that strikes me as inappropriate.
Well,
you could have dragged him out in the desert and shot him in the head, right? I mean, that might be playing God.
It may have been arguably ethical, but it could also have been me signing his death warrant, or, he goes brain dead, same thing.
Right, sure.
Except you can harvest his organs then.
Okay, sure. But I think about that in contrast to the whole, the famous situation with Eddie Gallagher and the person that they ended up pretty much killing, and practicing on, two totally different things in my mind. Yeah.
No, it's just making a life and death decision.
Sure.
Surgeons do it all the time. You may have done it or will.
Sure.
It's just, you got to understand where you think the boundaries are and make the best you can.
Right.
And that's what I did.
Right. Absolutely.
The last story is about field sanitation. So wherever you are, you know that you're going to throw lime, usually quicklime, on whatever excrement you have just laid down in a latrine pit. And very often now we're using porta potties on exercises. But when you're truly deployed, you might build a porta potty, but it's going to be dumping into a cut-off drum.
Mm-hmm.
And so you still need to throw your cup full of lime on the excrement. Okay. In Saudi Arabia, they have what I call soft touch flies, meaning you don't feel them. They can be crawling on your face and you won't feel it. You ever seen those advertisements where give to the Children's Relief Fund and here's a kid with flies crawling on his face?
Oh, yeah.
Those flies, you don't feel them. Their touch is that soft. And they're everywhere. They're ubiquitous. You ask yourself, how can a fly live in a dry desert, like this?
Sure.
But they do. And they're everywhere, so they're a great vector for disease transmission. So we had to be very, very careful about this. I went to a neighboring logger or a neighboring site, and I watched these drums that were coming out of the latrines that are filled with excrement on a wooden pallet that's being dragged down a street, and they're going to empty them into a big pit that's about 100 meters outside the fence, outside their berm. and it's sloshing and splashing like you would expect. Yeah, they're leaving a trail of this, and flies are ubiquitous. And they're not doing anything, even at the pit, to try to cover this stuff up. So here's how the Army's command system can work. I told them, I stopped that vehicle. I was a major at the time. And I said, you don't move this vehicle until someone senior to me comes along and tells you it's okay. And I marched into the command tent and I said, this is a problem, right? And they weren't excited about doing anything about it. So I went back to my own command, told my colonel. The colonel went up the chain, and it didn't take 2 hours before the Corps had their field sanitation people out there to make corrections, forcing everything to be cleaned up and a new mode of disposal to be implemented.
Got you.
I mean, no time at all.
Yeah, it's pretty efficient.
That was real efficient. You know, the Army takes it on the nose a lot. I had in-laws once that laughed over the fact that an Army sleeping bag had instructions in it. See, you're laughing too.
I'm laughing with you.
But the Army actually has a lot of competent folks in it.
After spending all that time in the military and now so much time out of, how would you contrast the civilian medical system in the United States versus the military medical system as far as just, I guess, your experience or quality of care or efficiency or whatever?
So once I was retired, I was on TRICARE. And despite the promises pre-commissioning, right, where they're trying to entice you to go for a commission, you're going to have lifetime free medical care, they lied. That was a policy. It was not a law. And at some point in time, they said no.
Oh, okay.
So now, even though it's cheap, it's much less expensive than what you pay or others probably pay.
Mm-hmm.
There's still a cost there.
Sure.
In any event, despite the broken promise, we are pushed off post to private providers. So I have the same health care, in essence, that you might have because I don't go to the military hospitals. We're all off post.
I have a lot of patients, really, that come to us as for their primary care, but they still do things with the VA also.
All my experiences with military hospitals have been very good. There was never a long wait. At Walter Reed, everything was great. I mean, I wasn't sitting in waiting rooms for very long times. Everybody explained things to me. They actually did a better job explaining than my current general practitioner does.
Mm-hmm.
She'll prescribe things, but I got to pull explanations out. I want to know the mechanics.
Okay.
Not just take this pill and come back in 2 weeks.
Right.
You know, she'll do anything I ask her to do, like, can I have scopolamine? I've heard about this, which, by the way, is proof that God loves us. Scopolamine is, you know. I was on a boat in Lake Superior with seas that were 7 to 8 feet tall in the cabin, which is not where you should be if you're going to get seasick, eating salami and cheese 10 feet away from a lady that was puking her guts out.
Sure.
And I was looking inside, not at the horizon, not out the windows, just watching her, you know, wondering, should I go over there and try to help her? I had no queasiness whatsoever, nothing. I could have gotten in a dryer like the astronauts did for the Mercury program,
Mm-hmm.
you know, and spun myself. It wouldn't have mattered.
Nice.
Scopolamine. Yeah, drug of choice. Yeah, I will never go any place there. I think there's a risk of air sickness or seasickness without that.
Yeah, that's a pretty cool system, and you can leave it on for like 3 days too. A little patch.
You know, this might be an alibi. An alibi in military sense means a PS. Right?
Okay.
Something I forgot to say.
Yeah.
I have always been susceptible to motion sickness. Always. Except for 2 instances. If I am on a commercial aircraft, it does not seem to matter to me, even in turbulence. Or if I am at the controls of an aircraft, I have no problems. But if I'm in the back of a small aircraft, I'm in danger, serious danger
Mm-hmm.
of becoming sick, and yet I'm a pilot. Think about that.
Right. Sure.
It's something I've never been able to understand. I'll get car sick in the back of a car if the road is windy at all.
Right.
But I can fly an aircraft through a thunderstorm.
There must be something where your brain just switches it off. Like, this is too important. We can't be doing all that, you know? I don't understand it either, but I had a very similar experience working on the ambulance. I'm also very prone to motion sickness. Don't like, I want to be driving the car. I don't want to be riding,
I knew there was something I liked about you when I first met you.
Okay. I have to medicate myself if I want to do roller coasters or, I'm not interested in any of that. But like bouncing around the back of an ambulance for 20 years, never got sick one time. That's very weird. Yeah.
Say the magic word. Magic word, scopolamine. I'm serious. I mean,
I ride it all the time when people are going off on cruises and stuff. I'll send it with them.
Yeah, take it yourself.
Next time I go to Busch Gardens or whatever, I'll put one of those patches on.
And it did not make me sleepy.
I've used meclizine for that in the past, pre-medicating, but it does make me a little foggy.
And I don't think meclizine's as good, having significant experience with both. It's just not as good. With that comes the end of all the stories that I can think about.
That was fascinating.
Yeah.
I appreciate you sharing all that.
I appreciate your asking.
And that was like half of your career, right? Your post-military career was another whole story, right?
Yeah, well, 10 years as a defense contractor, and then 10 years as a GS-15 and Missile Defense Agency.
Yeah, very
or
cool.
Or an NH-4. They've got a different scale there.
Well, Rick Caniglia, thank you very much for your time. I've really enjoyed the conversation.
Welcome. It's been an honor.
I would love to share your critical incident on the podcast. If you have a story you want to tell, send it to me by email at thekppod@gmail.com. That's thekppod@gmail.com. You can send it in writing and I'll read the story. You can make a high-quality recording of yourself telling the story and I'll play that. Or I can interview you about it, either remotely or in person. Thank you for listening, and as always, stay safe, take care of yourself, and take care of your patients in that order.
Man, this is just like what you see with Joe Rogan sits down.
That's right. That's right. This is the same caliber of interview, of course.
Well, it really is.